Hello and welcome to another Facebook Live broadcast with MedStar Health. My name is Michelle Carter, and today we're going to be talking about strokes, the different types, treatment options, and the recovery process. I'm joined today by Dr. Rachna Malhotra, Medical Director of the Stroke Program at MedStar National Rehabilitation Hospital. Also, Dana Jacoby, Board Certified Music Therapist at MedStar NRH, and Shannon P. Burton, the lead stroke nurse practitioner at MedStar Washington Hospital Center. We have a lot to cover today, so if you or someone you love has been affected by stroke and would like to learn more about treating it and reducing your risk, stick around, share this broadcast with your friends, give us a like to let us know that you're here, and ask your questions in the comments below. We're going to take some time to answer those as well. All right, so Dr. Malhotra, Dana, and Shannon, welcome and thank you all for joining us today. I'm excited to learn more and have this important conversation with all of you. So to get started, I'd like to give you all a chance to introduce yourselves. So Dr. Malhotra, will you tell our viewers about yourself and your specialty?
Hi, everyone. Thank you for having me. So I'm the medical director of the stroke recovery program at National Rehabilitation Hospital. I've been here practicing for about 12 years, but I was here prior for training. So I've been here for a total of 15 years and I've loved it the whole time.
So thank you so much for joining.
Thank you.
Dana, I'll turn it to you.
Hi, everyone. My name is Dana Jacoby. I'm a board certified music therapist here at MedStar National Rehab Hospital. I started here just about a year ago, thanks to a lot of efforts by Dr. Malhotra. She really advocated to get music therapy here. And we're going to talk about the music therapy program in a little bit. Thank you.
Thank you. And Shannon, I'll turn it to you.
Hi, and thank you for having me. I work at MedStar Washington Hospital Center, and I am a nurse practitioner here. I've been working with the stroke team at MedStar Washington Hospital Center since 2014.
Thank you so much, Shannon. Thanks for being on our team, and thank you all for joining us today. So Dr. Malhotra, could you please tell us more about the stroke recovery program?
Yep. So again, Dana and I are at MedStar National Rehabilitation Hospital, and I think we had mentioned what our mission is. Our mission is adding life to years. So our goal is patients with different illnesses, disabilities from acute care hospitals come to our hospital specifically for our program, for the stroke recovery program, to add life to the years they have. And so that's our big deal. Our patients go under inpatient therapy, outpatient therapy. We have a lot of community practices as well.
Oh, great. And how does the stroke recovery program at MedStar National Rehabilitation Hospital fit within the larger system at MedStar Health?
So the way it fits in is pretty much once someone has a stroke, they will go to one of the acute care hospitals. So we have Shannon from MedStar Washington Hospital Center, or MedStar Georgetown Hospital Center as well. So they'll go there, they'll get treated from the stroke, any interventions that need to be done, they'll become stabilized, become medically stable. And at that time, if they're able to participate in 3 hours of intensive therapy, including physical, speech, and occupational therapy, if they have, and they are medically stable, they're able to come to our hospital. And most patients with stroke come to our hospital. The length of stay is about a little over 2 weeks for intensive therapy, then to move on. And I'll go into a little bit more of that later, I think.
Thank you. Thank you. Could you also share what exactly happens during a stroke and what makes them so scary?
Well, I think it's really scary, and I think it's interesting. So Shannon can give her perspective, but I get the perspective of the aftermath, and we'll talk about that as well. But when someone is having a stroke, you can have a lot of different things go on, either difficulty with speech, difficulty with thinking, weakness in your arm, weakness in your leg, numbness and tingling, difficulty with balance. So there are lots of signs and symptoms we'll talk about. And sometimes not everyone knows it's time to go to the hospital. And I think part of our point today is try to say, when something like that happens, you don't want to, no one wants to go to the ER, no one wants to go to the hospital, but go. I have a lot of patients that have not gone right away and probably have missed some of the interventions that they could have undergone.
And thank you for sharing that piece that, when it comes to stroke and any other urgent medical conditions, time is of the essence when it comes to responding and treating the condition. So thanks, Dr. Malhotra. Now I'd like to turn to Shannon P. Burton, the lead stroke nurse practitioner at MedStar Washington Hospital Center. So Shannon, could you share what are the warning signs and symptoms of a stroke and why it's important to get to the hospital as soon as possible?
Yeah, sure. So some of the warning signs of stroke, we use the acronym BFAST. And it's a kind of a short acronym to just help everyone remember. So to go over each letter, so B in BFAST is for balance. So if you have a sudden difficulty with your balance, you feel like you're walking like a drunk person, all of a sudden you're very dizzy and nauseous. The E stands for eyes. So have you lost vision in one eye suddenly? Do you have difficulty seeing on one side of your world? Do you feel like your eyes are kind of like all over the place and not coordinated when you're looking? So any sudden changes like that. The F is for face. So facial drooping on one side of the face. That can include the upper face or the lower face. So sometimes the eyelid may droop as well. The A is for arm. So a lot of the time with most strokes, patients will have some arm weakness. So if you ask your loved one or yourself to hold their arm up and you notice that the arm is drifting down, same in the leg. If you notice sudden leg weakness. S is for speech. So that's difficulty understanding what someone is saying. So if someone's talking to you and the words are coming out very garbled, the words are very slurred, but also when you can't understand what someone is telling you as well. So that's the S stands for speech, and the T stands for time. So we want you guys to come in right away because that's very important. As Dr. Malhotra was stating before, we have treatments that we can potentially provide to patients if they come in within a certain time frame. So that time frame is really critical. So once you notice these symptoms, you want to call right away. Try not to say, let me sleep it off. Let me just sit here and wait and see if it gets better. But if you notice these changes, you want to call 911 right away so that we can be prepared to receive you to start doing what we need to do as far as workup and potential treatment.
Thank you. I think that's a good acronym and gives a good visual too for what visible signs to be aware of when it comes to responding to stroke. So let's talk about the different types of strokes. Could you tell us more about there's ischemic strokes versus hemorrhagic strokes?
So ischemic stroke is the most common. So that's the blockage type of stroke. So when we think of strokes, we want to think of like it's a piping problem. So an ischemic stroke is when that pipe gets blocked by a blood clot or a plaque, and it causes decreased blood and oxygen to go to the brain, causing injury and damage to those neurons, which then cause you to have the symptoms. And a hemorrhagic stroke is when you have bleeding. So a blood vessel in the brain has now ruptured or opened up, and blood is now outside of those blood vessels and inside of the brain tissue. The thing is when you're having these symptoms at home, you and I can't tell whether it's an ischemic stroke or a hemorrhagic stroke because they look similar, they look the same. And so it's coming into the hospital and us doing a head CT or an MRI to kind of figure out, is this a bleeding type of stroke or is this a stroke caused by a blockage? So if you notice that you're having stroke symptoms, we don't want you to take a handful of aspirin. We want you to come to the hospital right away so then we can determine whether it's a blockage type of stroke or a bleeding type of stroke.
Thank you very much, Shannon. At this time, I'd like to welcome our viewers again. If you're just joining us, thank you for tuning into our Facebook Live. Today, we're talking about strokes, the different types of strokes, treatment options, and the recovery process. I'm here with Dr. Rachna Malhotra, Medical Director of the Stroke Recovery Program at MedStar National Rehabilitation Hospital, Dana Jacoby, Board Certified Music Therapist at MedStar NRH, and Shannon P. Burton, the lead stroke nurse practitioner at MedStar Washington Hospital Center. We have more to talk about, so keep watching, share this broadcast with your friends, Give us a like to let us know that you're here, and be sure to share your comments and questions below. We're going to take some time to answer some of those now. So my first comment slash question comes from Karen. Thank you for tuning in. She shared her experience with us about how her husband had a cerebellar stroke. Thankfully, he did recover, and we hope he's doing much better now. For the rest of our audience, Dr. Malhotra and Shannon, could you share more about what cerebellar stroke is and its signs and symptoms?
So I can start, and Shannon, you can come in, but I think that was a great question, because of what we're talking about with the BFAS. A lot of times we talk about stroke and we talk about weakness in the arm, and all of a sudden you can't move your arm. Cerebellar strokes are in the brain stem and affect more balance. People with those type of strokes have balance coordination deficits, as well as nausea, vomiting, dizziness. So a whole other area of symptoms and signs that people will have with cerebellar strokes.
Yes, and I agree with Dr. Malhotra. Some of these patients, you may not have weakness, so you may not have those typical signs and symptoms, but definitely the balance, the nausea, the vomiting, you will see those symptoms.
All right, thank you both for addressing that, and thank you, Karen, for sharing your experience with us. We also received a comment from Roshana, who also had a hemorrhagic stroke. We talked about this a little bit earlier, so the replay will be available right after this live broadcast. So be sure to tune in right when we're done, Roshana. So we hope you're doing much better now as well. And then lastly, we had a comment from Christina. She's one of our patients, so thank you for tuning in and sharing your experience with us. We love when you do that. She says, this is for Shannon. She says, Mrs. Burton took great care of me when I had my stroke. Never got the opportunity to thank her, so I want to thank her for providing amazing care. So that's a testament to the great work that you all are doing at our hospitals. So thank you very much for taking great care of our patients. We appreciate it, and they clearly do appreciate it. So thank you. All right, let's continue with some of my questions. I'd like to turn back to Shannon. So earlier we talked about the different types of stroke, ischemic, hemorrhagic. We also touched on cerebellar. So could you share the differences in how these types of strokes are managed and treated?
So for the clot type of stroke or the ischemic type of stroke, when you're coming into the hospital, we're trying to, also with hemorrhagic, we're trying to figure out why you had the stroke and try to figure out if it is from a clot, where did this clot come from? So we do other testing to try to figure out if there are other medical conditions that the patient may have that predispose them to developing a clot and it causing this blockage. Or does the patient have plaque buildup from high blood pressure and diabetes and high cholesterol? So trying to also manage those risk factors to prevent another stroke from happening again. So we typically look for those things. And then we try to manage those risk factors. If the patient comes in acutely and they're eligible for a clot busting medication called IVTPA, you may hear the name Alteplase, you may hear the name Tenecteplase, but these are clot busting medications that we can give if the patient comes in within the time window for that. There are also other procedures where we can go through the groin up to the brain to try to pull a clot out if the patient is appropriate for that type of treatment. So that's usually how we manage the clot type of stroke. With the bleeding type of stroke, we want to make sure, do we see abnormal blood vessels in the brain? Do we see an aneurysm? Does the patient need surgery to try to stop the bleeding or to remove some of the blood from the brain? So there are different treatment options based on what the patient presents with, whether it's the clot type of stroke or the hemorrhagic type of stroke. We're working to try to prevent it from happening again. So on the ischemic side and on the hemorrhagic side, it's really about managing those risk factors. High blood pressure is number one for both. So we want to come in and try to really manage those.
All right, thank you. Thanks for explaining that, Shannon. I've also heard the term mini stroke. It could sort of imply that it's not it's minor, not as significant as a regular stroke. Could you explain what that term means and why it can be inaccurate?
Yes. So mini stroke can be a term that people use for different situations. Sometimes patients will have warning signs for stroke or something called a TIA or a transient ischemic attack, which could be labeled as a mini stroke. And then there are also patients who just come in and they have very mild symptoms or a very small stroke and they feel like that, it could be termed a mini stroke. But the misleading part of it is at the end of the day, you've had an event that's caused decreased blood to the brain causing symptoms. And we want to make sure that we are controlling whatever risk factors you may have to keep you from having a stroke that leaves you with some permanent disability. I think mini stroke gets labeled with things that are more minor, but in all actuality, these minor things can lead to a major type of stroke. So we want to take the minor and the major seriously and really try to control the risk factors that we can to prevent someone from having, one side that doesn't move, not being able to speak, and having their life truly altered.
Great. Thank you, Shannon. I think that's a great segue to turn back to Dr. Malhotra to talk about the risk factors and prevention. We even received a question from our audience member, Tom. Thanks for tuning in. Who's asking, what are the best ways to prevent stroke from occurring? So can you talk more about prevention? What can be done at home to minimize your risk?
Yes, so that's an amazing question. And I think we want to prevent a stroke from ever happening. And then in our case, everyone I see already had a stroke, but I think it's very important to prevent further strokes from happening. So I always tell all my patients, we cannot control everything in the world. We don't have full control, but there are certain things we can control. Most importantly, see your primary care physician at least yearly. If you have high blood pressure, if you have diabetes, take your medications. You may not want to take them, just take them. There's a reason that they're ordered for you. And then I think that's very important. And then after that, diet, heart healthy diet for everybody, right? Everyone needs a heart healthy diet. If you're diabetic, we want low sugars as well. But in general, a heart healthy diet, we also sometimes call it we use the Mediterranean diet, which is low salt, low fat, low cholesterol, less meat, less fried foods, only on treat times, less fast foods. We want vegetables, grilled meats. So this is all very important. And then exercise. So moving your body at least it would be great to get your heart rate up 30 minutes a day for, not every day. I mean, who can really do it every day? If you don't really want to, do it 5 times a week, do it 3 times a week, 4 times a week. But those are things that you have full control over. You can take your meds, you can see your doctor, and you can try to exercise and eat healthy.
I think that's great advice, even for people who may not be exactly at risk for stroke. Eating well, exercising, taking your medications that are prescribed by your doctor, things like that can be helpful for you to stay proactive about your health. So
exactly,
all great advice. I'd like to take this back to Shannon. We talked earlier about time being essential when it comes to responding to a stroke. So if a stroke does occur, can you or a loved one choose where you receive care?
So when you're noticing the symptoms and you're calling 911, we just want you to get to the closest hospital that can provide you with care. Trying to drive in, it could prolong the time. It could have you sitting in the waiting room waiting to be called. But calling 911, them sending you to the appropriate hospital, I think is the best thing because time is of the essence. So if you get to a hospital, they can at least start the treatments. And if you need a higher level of care or to be transferred to a hospital that has more capabilities, we can do that as the care is continuing to be provided. We don't want you to try to navigate the DC streets or Maryland streets trying to get to a hospital. We want you to use 911. They can activate the system before you even get there. And we're already collecting information. We're already preparing for you once you get here. So definitely 911 in the closest hospital.
Great, thank you, Shannon.
Mm-hmm.
Dr. Malhotra, could you share what happens in the aftermath of the stroke after someone has already suffered one? What do they do next?
Yep. So first of all, so we're very grateful for our colleagues at the MedStar Washington Hospital Center and the stroke team for stabilizing those who had strokes, figuring out why, getting them on the right medications, and then coming to us. And the aftermath is very different depending on what type of the brain was affected by the stroke. Certain strokes, you'll have weakness in the arm. Certain strokes, you'll have weakness in the leg. You'll have decreased sensation. You may have difficulty with your swallowing. You may have difficulty with your talking. So it really depends on where in the brain it was affected. But no matter where, there obviously things have changed in your body. And so the goal for us now is to get you better and stronger with what has been happened.
Thank you. I think that's a good lead in to talk about the recovery process. So could you share more about the stroke recovery program and what patients should expect?
Yep. So our inpatient stroke recovery program consists of 15 hours of intense physical, occupational, and speech therapy on a weekly basis. So you get about 3 hours per day. And depending on what the aftermath was, did you have weakness in the arm or leg and you have difficulty walking, or did you have difficulty with speech but your arm and leg are moving fine? Your program is tailored to that to get you stronger. So we try to get our patients from the stroke team at Hospital Center fast. We want them here so we can just, once they're stable, get them moving, get them up, get them standing, try to get them walking if that's what is necessary. And as I mentioned before, the average length of stay here is about a little over 2 weeks. And then after that, no one recovers from a stroke fully in 2 to 3 weeks. But after that, we will either have to go to another level of care or go home with continued therapy. So you'll do home therapy. And then after you improve with home therapy, you transition to outpatient therapy. So the recovery process, it just depends. I always say the first 3 months is when we'll see the most improvement for someone who has difficulty and weakness and walking. With speech, it takes longer. For those with large strokes with a lot of changes, it can take up to a year. We never really know where we're going to get till we get there.
That makes perfect sense. Thanks, Dr. Malhotra, for sharing that. We explained the recovery process, how long it usually takes. Could you also share what other support is available for patients during recovery?
Yes. So in-house we have, and we'll segue over to our music therapy as well, but we have recreational therapy. We have neuropsychology that sees all of my patients. Therapeutic rec, music therapy, again, rehab nursing. So I think education is really important, but then after we go out into the community, we have a lot of community resources as well. We have a stroke comeback club at NRH that meets, right now we do it via Zoom on the 4th Monday of the month at 1 p.m. So that's what a lot of our stroke survivors kind of come back for that. We also have an open gym in which our patients come to NRH on Saturdays. I want to say Saturdays and Tuesdays to use some of the facilities that we have.
Thank you. I think it's great for patients and their relatives and caregivers to know that they're not alone in this recovery process, that there is support available, and also knowing that there are survivors along with you. Going through the same ups and downs that you go through, it can be really helpful and reassuring to know that you can bounce back. So thank you very much. Right now, I think that's a great time to pull in Dana Jacoby, our board certified music therapist at MedStar National Rehabilitation Hospital. So thanks again for joining, Dana. Could you tell us more about the music therapy program?
So I started here about a year ago now. I'm the first ever music therapist with MedStar Health, and I'm so lucky that I was able to start here specifically at NRH. And what the music therapy program entails is I usually get a referral from somebody like Dr. Malhotra, or one of the other therapists on the team may refer their patient, their physical therapist, their occupational therapist, or speech therapist, may put in a little plug that they think a patient would benefit from music therapy. And what music therapy is it's using music as the tool for change. So I use music with patients who may have speech and language difficulties, who may be able to think in their mind like they know what they want to be able to say, but they cannot actually express it. That's because of aphasia that they have. So I use music and rhythm to try to help patients with speech and language deficits. I also help with physical therapy as well. So I'll use music while patients are trying to gain ambulation skills again, balance, coordination, increasing their step length. So I'll work with physical therapists like that. And I also work with other just like sensory motor impairments. So maybe a patient has one-sided weakness in their arm. They may need to work on fine motor skills, and music can really help with all of that. And it also just addresses the mental health portion of having a stroke as well. It could be just a really dark time for patients because everything is so new and their life has been changed. And so having music is something that kind of normalizes the experience and just helps people with, uplifting their mood some as well.
I love that. I really find that fascinating. I was a music nerd. I was in choir my entire life growing up in school and in college. So it's great to know that, music can be powerful, even, in the healing process for these types of conditions. So that's really, really interesting to me. So I want to bring in the entire group. We have a little bit more time. So I want to share an audience question. This comes from Julia. She says, my mother had a stroke in 2020 and now deals with numbness and tingling on her right side, as well as aphasia. So she's asking, how can she ease her mother's anxiety when trying to communicate with people outside of the family? So any advice that you could share?
So I think so aphasia, the word aphasia means speech deficits after a stroke. So either unable to, in this case, sounds like unable to say what you want to say or get your point across. So in the aftermath of a stroke 2 years ago, she probably underwent therapy, and then you'll probably have your close group network of people who understand you and you feel comfortable with. And I think it's very normal family takes you to a party and you're just there with all these new faces. And I think it's really difficult. There's a lot of different things. I'm actually a big proponent of using antidepressant medications in these cases sometimes. I think that people don't always love that term, but I think that after a stroke, there are dark times, and especially when you can express yourself. And a lot of times just having a little mood lifter is not a bad idea. And a lot of times I do recommend that, not for a long period of time, but for short periods of time. I think also, I think that's huge. And then again, speak with your doctor about what you would want to speak to your doctor about that.
All right, thank you. All right, as we close, I have a few questions for the entire group. So feel free to chime in when you like. So this is about community education. So how does education fit within the stroke recovery program? Could you guys elaborate on that? Start with Shannon.
Okay. So for us, community education is very key because we do get a lot of patients who don't come in once they have the symptoms and they kind of wait. So educating that, we want to make sure we're educating the community on the signs and symptoms of stroke and the importance of seeking care and treatment early. So when you're here, we do a lot of education with patients and families about, stroke warning signs. We also, in the outpatient setting, we have stroke clinic where we can also talk about that. And then we also participate in some events around the city, providing stroke education to the community, because our number one thing is time is of the essence, and we want you to get here as soon as possible.
All right. Dana or Dr. Malhotra, would you like to share anything?
Yeah, so like Dr. Malhotra said, there are some community resources available to patients after they leave our facility. So she mentioned the Stroke Comeback Club is one of them. There's also Brain Injury Association of DC. She also, Dr. Malhotra touched on our adaptive fitness program that happens. We have open gym on Tuesday nights and Saturday mornings, where patients can come in and like train with professionals, trainers who are knowledgeable about patients who have strokes, and they may have some limitations or adaptations that they need to be mindful of. There's a lot of groups out there. I am an endorser for Aphasia Recovery Connection, or ARC. It's an online platform where it's just another community resource for patients who have aphasia, can come together and they can talk about different things that they're experiencing and just be among peers, because that's really helpful in, having people who understand what you're going through and offering their own tips and tricks out to other people. So I'm a part of that group as well. Is there anything you want to add?
I think the only other ones, we were talking about aphasia. So there's the Stroke Comeback Center that we're not affiliated with, but it's privately run in Rockville, and I believe one in Vienna or Falls Church area. So a lot of my patients who have completed speech therapy but still have speech difficulties sometimes go to that center, in which they offer courses, and again, community camaraderie for those going through the same, because it is a lifetime, right? It's a lifetime of recovery a lot of times, and so it doesn't end when you leave the hospital center. It doesn't end when you leave the rehab hospital. It doesn't end. So I think that's our goal, is just to get our patients to come back to our community outreach programs that we have, as well as others in the DC area.
All right, thank you all for sharing that. I'd like to fit in one more audience question. Thank you again to those who are tuning in and sharing your questions and comments and experience with us. This question comes from Barbara. She's asking, will you explain the difference between the left side and the right side stroke? Why it affects one side versus another, and the effects of both versus just full paralysis on one side.
I guess I can start with that. So the left side of the brain is what we call the dominant hemisphere, and that controls the right side of our body. And patients who have strokes on the left side of their brain may not only have right side weakness, but they may have difficulty with their language, so speaking. They may also have some difficulty with vision on the right side as well. So when we think of the brain, left side of the brain, right side of the body. And then the right side of the brain controls the left side of our body. So then you could have left face weakness, arm weakness, or leg weakness. Patients on this side may also not recognize the left side of their world. They have something called neglect. So those are the really big differences. So just remember, it's kind of crossed. So right side of the brain, left side of the body, left side of the brain, right side of the body. Then when you get into the brainstem, it can kind of be a combination of the two. But for the most part, for the lay community, left side of the brain, right side of the body, right side of the brain, left side of the body.
Great. Thank you very much. And thanks, Barbara, for tuning in and sharing your question with us. So I have another question. I think this is pretty exciting to talk about what's on the horizon when it comes to stroke treatment and prevention and recovery. So Dr. Malhotra and Shannon, could you share any exciting innovations, research, any new technology that you could share about, when it comes to treating stroke?
So, yeah, I can mention a couple of things that we have here. So first of all, we've recently, not recently, in the last year, started a high intensity gait program in which our physical therapists are pretty much getting most of our patients that can, working really hard on a treadmill with weights and really just pushing them to stand and move. And so it's a new way to look at rehabilitations after stroke. And so that's something that we've recently started. And then we have a lot of fun gadgets and fun things here. We have an exoskeleton. So it's a device that we put on the outside of the body for those who can tolerate it, which helps them walk. So they learn the feeling of what it is to walk after you've been in the bed for quite a while. And then we also have a lot of research going on through with hospital center with NRH, and so there's some aphasia research at Georgetown and quite a few different research studies as well. But I have a long list. I don't think I can get into all of that.
Yes, and then as well as Washington Hospital Center, we don't have all the cool gadgets like they have at NRH, but we do have some active clinical trials that we are enrolling patients in who have had stroke. Some of them are acute therapies when patients first come to the hospital. Others are clinical trials for patients after they've had a stroke and some of the management afterward. So we do have that here at Washington Hospital Center. We are a comprehensive stroke center, so we're able to do other procedures that maybe a primary stroke center may not be able to do. So those are some of the innovative things we have going on here at Washington Hospital Center.
All right, that's all great information to know. Thank you guys for explaining that. We have a few more audience questions, so we have a little bit more time. So I want to make sure that we take time to address those real quick before we close. This one comes from Cynthia, who's asking, if you had a history of seizures growing up, are you more prone to have strokes as an adult?
So I can start that one.
Okay.
If you've had seizures as a child, it doesn't necessarily mean that you're going to have strokes as an adult. It's all about, making sure as you get older that you're monitoring for risk factors for stroke. I think that's the biggest thing, making sure that, those big lifestyle things, high blood pressure, diabetes, those things are being taken care of. And I don't know if Dr. Malhotra has something to add.
No, I totally agree. Just because you had seizures does not mean you're going to have a higher risk of strokes. But on the other hand, after strokes, you can possibly have a higher risk of having seizures. So that's something that can happen down the line, which we didn't touch upon as well. But I think making sure the seizures are managed, as Shannon said, taking your meds, seeing your neurologist is the most important.
All right, thank you for clarifying that. We had our second audience question that just came in from Pam, who asked, is it common to have seizures prior to a stroke? I think you said it's more likely that they'll have seizures after they've had, or there's a likelihood that they can have it after the stroke versus prior to the stroke.
And then you could also, and Shannon, let me know what you say, how your thoughts are, but also presenting. Sometimes people, when they have the stroke, will have a seizure around the same time. So that does happen sometimes. It doesn't mean that you're going to keep having seizures at all. Sometimes it just happens with the stroke because there's something going on in the brain. If you did not have a seizure at all, yes, having a stroke will predispose you to having seizures in the future. Not necessarily will happen, but there is a chance.
All right, thank you. Thank you both for addressing that question, and thank you to Cynthia and Pam for sharing your questions with us. So as we wrap up, I'd like to ask all of you, what do you most want people to take away from our conversation today about stroke and stroke recovery?
Okay, so I feel very strongly about this, this is what I mentioned before, and this is what I just talk about all the time, is control what you can control. That's the bottom line. Your doctor tells you have high blood pressure, take your medications, check your blood pressure at home, write it down, make a list of your blood pressure numbers so you can give it to your doctor and they can really know if you're on the right medications. Sometimes people have strokes, their blood pressures are fine. They'll say my blood pressure was fine, and then they were in the hospital with a very, very high blood pressure. So sometimes things happen that's not in our control, but you have to do what you can control. So I think knowing the risk factors, diabetes, hypertension, make sure you eat well, make sure you exercise, 4 things. And if that can help, I think that'd just be wonderful.
I totally agree. I piggyback on that, and know your numbers. So know what your blood pressure is, know what your cholesterol is. If you're smoking, attempting to quit smoking, we don't want smoking to be a part of our lifestyle because that increases your risk not only for stroke but heart attack and other things. Time is of the essence, as I've mentioned before. And then if you don't have a primary care provider, get in contact with one. Get to know them, have a trusting relationship with your provider so that you can continue on a healthy path.
All right, oh, go ahead, Dana.
Oh, no, I think they just about covered everything that I was thinking. Yeah, have a plan in place for, if something like this does happen, you want to be prepared.
Agreed.
Absolutely. Well, thank you all again. As we close, we have a surprise for our audience from our music therapist, Dana. So I'm going to turn it over to her to share a special performance for us. Dana, take it away.
Sometimes in our lives, we all have pain, we all have sorrow, but if we are wise, we know that there's always tomorrow. Lean on me when you're not strong, and I'll be your friend. I'll help you carry on, for it won't be long till I'm gonna need somebody to lean on. Please swallow your pride if I have things you need to borrow, for no one can fill those of your needs that you won't let show. Just call on me, brother, if you need a hand. We all need somebody to lean on. I just might have a problem that you'd understand. We all need somebody to lean on. And call me, just call me, call me, call me, just call me,
Thank you so much, Dana. I think that was beautiful. Thank you so much for sharing your talent with us. We really appreciate it. And thanks to all of you. Thanks to our speakers, Dr. Malhotra, Shannon, and Dana. Thanks for joining us today and sharing your expertise and valuable information today. That's all the time we have for today. Many thanks to our viewers for tuning in, sharing your questions and your experience with us. We really appreciate your time. If you're interested in learning more, or if you'd like to see a neurologist about stroke prevention or treatment, please call 202-877-3154 or visit our website. We're going to add the phone number and the link as well in the comments below. So thanks again for joining and have a great day.
Thank you so much.
Thank you.